with us, so I don't want to take up any of their time. The voice you may have just heard might have stolen a little bit of my welcome thunder, but yes, welcome to this evening's session. As you may well be aware, we are recording the session, so if you have any kind of technical issues that occur, the best thing to do would be to leave and rejoin the webinar, and if that works, fabulous. If it doesn't, for whatever reason, don't worry, there will be the recording to be shared with everyone who is registered after the event, so you'll still be able to access all of the content. Throughout the evening, I will introduce our panelists and they will present. If I can ask if anyone has any questions, if you can put them into the chat box. My colleague Rachel and I will be monitoring that for you. And what we're going to do is allow both of the panelists to cover their sessions, and then we will have a panel discussion with both of them. Put those questions in as we go along, and Rachel and I will share as many of those questions as we can after both of the sessions. So before I do a little bit of scene setting about the RFU's Women and Girls Health Toolkits, I have got a little bit of a brief video to share with you guys, which comes from an initial symposium that we ran in the 22-23 season before we started creating the toolkits, and it was a really good opportunity to speak to players, to speak to coaches, to get their opinions on kind of women's and girls' health and what would be helpful and what would be needed within the toolkits as we develop them. So I'm going to let that video play now, and then I will carry on.
I think that's made the biggest impression on me is everything that was taught about the anatomy, and so everything that was about breasts and the menstrual cycle, because I think that's a really key thing in women's sport and just in women in general that's not taught enough, I think.
From the menstrual health perspective, the more and more conversation around the cycles, and not every player is going to perform at a certain level depending on where they are in their cycle. It's almost a bit validating to hear that from the professionals today.
I was talking to one of the coaches today, and he said to me, when the team are visiting, we make sure that there is sanitary towels, we make sure that in their thing with a little note on it. And I thought it's something I never even got across in my mind. So therefore, rather than waste time, I picked up the phone, I called the girls' managers, who is actually closely related to me, and I said, do we have this facility? She said no, but I said, why not? I said, as from now, can you check with our chairman to see if we can get this in place, and then we can actually put in our club. And all the first aid bags now will have a section in it which will have sanitary towels and stuff like that. It's something I never even thought about.
I had brought a coach in recently when I was giving a talk on menstrual cycles, where I said, look, this is an elite athlete. This is an elite athlete who has experienced the same issues that you have. This is how she dealt with it. And by opening up that conversation, creating a Q&A platform, it really allowed the players to engage and realise this is normal. This is women, this is rugby, and this is why we need to be having those conversations and understanding a little bit more about it.
For someone that was starting out new in coaching, I would advise them to learn as much as they can, as quick as they can, regarding menstrual cycles, anything to do with the girls' game, because the more you can learn, the better players you'll create at the end of it, because the more you buy in, the more they'll buy into learning what you're trying to get across.
Great. It's always good when videos work first time. But yes, that was a really good day that we spent with people from all walks of life and community rugby. And what struck us at the day was everyone's eagerness to access content and have those conversations around specific women's and girls' health within a rugby setting. So it was a really useful opportunity for us to hear from the people who are going to be accessing this information. So I'm just going to share my screen now. Right. And if someone wants to give me a thumbs up, if they can see that, thank you very much, Laura. So yes, some of you, this may be your first introduction to those of us who work in Rugby Safe. Hopefully not. Hopefully you're aware of us. But Rugby Safe is the RFU's community player welfare programme. It is run by my colleague Rachel Fall-Brown, who is the player welfare manager for the RFU, and I work with her as the Rugby Safe officer. You might meet a session, but yes, we work across kind of player welfare throughout the RFU, and the Women and Girls project around the toolkits has been something that we've been working on together over the last few months. But you can, if you're interested in our other Rugby Safe toolkits, you can find them all at englandrugby.com/rugby safe, or scan on the QR code, and that will take you through to all of the player welfare programs that we are involved with. So looking at the player health and welfare toolkit in a little bit more detail, currently the toolkits that are available to you via the QR code you can see on screen are our menstrual health toolkit. We have a breast health toolkit, which includes what I find is a very handy sports bra fitting guide to make sure I'm wearing the right bra when I'm out there on the pitch. We have our pelvic health toolkit, and very recently we have released our puberty and our menopause toolkits. So if you haven't had a look at them, I encourage you to go and have a look at that content after this webinar, because we're very proud of them. And they are not the kind of the end point of our development of women and girls support. And as you can see on screen, we are still developing our women and girls injury prevention toolkit. I will be talking in a second about the Women's and Girls CRISP project in a bit more detail, but we are also developing our pregnancy toolkit and our mental health and wellbeing toolkits, and they will be coming out in the second part of this season, possibly into the beginning of the next season. When we were looking at developing our content, we really wanted to make sure that it was accessible for players of all ages, life experience, and particularly genders when we're thinking of kind of coaches and match officials who support the women's and girls game in the community. We really wanted to make sure the language was going to be accessible to everyone. And so I've been very fortunate to have some very robust discussions with colleagues from different walks of life again about the content to make sure that it is an appropriate language level for everyone. And they are designed not to be a kind of one-stop shop for everything to do with the different aspects of women's health that they discuss, but really to empower the individual who's looking at them to make sure that they have the information to make the right decisions for themselves, or as a starting point for them to then have a look at a bit more information around a particular topic. And they have been developed with experts within their fields, and obviously you're going to be hearing from two of them this evening. And as I said, we are looking to develop additional toolkits, but we're also looking to develop additional content within those toolkits that have already gone live. So the information that's sitting in there at the moment is brilliant, but we're looking to develop that as we go along. So I guess watch this space. I just want to spend a very quick moment speaking to you guys about our CRISP project, so our Community Rugby Injury Surveillance and Prevention project. This is a project that's been running for a good few years in the men's and the age grade boys game, and has been available in the adult female and age grade female game for the last couple of years. The one thing that we really need from clubs and from teams is women's and girls teams to sign up to the project. What we really need to do is have the data from the women and girls game for us to properly understand those injury patterns that sit in the women's game and be able to measure them against the men's and see if there are differences, and that will then help us develop injury prevention programs that will be of benefit. We know will be of greater benefit to women and girls. We know that our Activate program will help prevent injury across the game, but what we want is we want more data in the girls game to see whether we need to provide women and girls specific exercises to further support that injury prevention programme. So if you are involved in a women's or girls team, if you can scan that QR code, or again, having a look at the Rugby Safe toolkits, there is the CRISP toolkit sits in there and it provides information on how you join up. And also you can look back at previous years' data, if that's something you're interested in. I appreciate it's not for everyone. So that's my little plug on CRISP. And that is, you'll be pleased to hear the end of that bit of the session. So now I'm going to hand over to my colleague, Alex, to introduce the next phase of the presentation.
Okay, a bit of interactivity now. I'm launching a poll to you, so you can join in here. If you can't see it for any reason, then please put your answer in the chat. But that should be with you now. Have you ever had a conversation with your player's coach about their menstrual cycle and how it might impact them? Yes, no. Let us know. I can see people have dived in and are used to this. And we've got majority of people have done it. So I'll just give a little bit of time just for those last few people. If you can't see it for any reason, yes or no, put it into the chat. Have you ever had a conversation with your player stroke coach about their menstrual cycle and how it might impact them? Well, I'm going to end that poll now. And I'm going to share the results with you. And Laura, 74% is no. With only 26% said yes. So very interesting.
Yeah, very interesting. It's not out with the norms, so it's probably what I would expect. So, but hopefully this sort of session tonight will give you the confidence to have those or start those conversations. And I will pull up my presentation now. You can give me a wee thumbs up if you can see that okay. Yeah, thumbs up, perfect. So thank you everyone. Yeah, so tonight I'm going to be focusing on menstrual health in general, but also from the context of rugby. Some of what you've heard within the video, the introduction to the video, we'll be touching on that and a lot more going in the next sort of 20 minutes or so. But just I suppose a thank you for the invite to come and talk here. Our family is certainly rugby has a lot to do in our lives. My husband was a pro rugby player. He is a coach now, has a full-time job. Kids are in community rugby, and I also coach at sort of the micro level, so herding sheep or herding cats, whatever. That's the type of level that I'm at in terms of coaching. But it gives a lot back. So thank you. We do love a bit of rugby here. So in terms of the overview of what I want to cover in the next 20 minutes, I'm looking to cover what's normal and what's not. It's often a question I get asked by a lot of athletes and actually coaches, what's normal. I'll talk about menstrual cycle related symptoms and the impact of potential symptoms. I'll touch on some communication and what we know in terms of the literature around communication, and then a little bit around what we can all do. And I mean, in me, you, everyone that's in this sort of online forum just now, what we can all do to try and improve menstrual health going forward in a sort of club capacity. But I just wanted to, sorry, I'm just going to try and get rid of this panel here. There we go. Just, I suppose, make sure that we're all on the same page before I get going around, maybe I'm preaching to converted with some people, but very briefly, when I'm talking about the menstrual cycle, I'm talking about much more than just a menstrual bleed, and often these can be sort of used interchangeably. But when we're talking about the menstrual cycle, it starts in day 1 and you can see in the graph here, and it goes all the way through to the day before the next menstrual bleed or period. And we'll get 2 sort of hormones, or main hormones that we talk about a lot is estrogen in the blue line here, and progesterone that's in the dotted red line there. And I suppose what I want to take you take from this is really that it's a repeating pattern of fluctuating hormones that, if we've got a normal menstrual cycle, will be fairly predictable. So in the early follicular, so it's split into two phases, the early follicular phase and the luteal phase, and in between that is ovulation or the release of an egg. And we have different phases where we have low estrogen and low progesterone when we have our menstrual bleed. As we approach the release of an egg, we have an increase in estrogen and a low progesterone at that point. Halfway through the cycle, we have ovulation, which is the release of that egg. And then the uterine lining needs to start building up in preparation for any fertilization that might occur. And at that point, we have high estrogen and high progesterone. And that really, towards the end of the menstrual cycle, we see this real dip in hormones going from really high to really quite low. And it's at that point we often see lots of symptoms that come into play. And I suppose looking at this graph alone, if you see these fluctuations, it's no wonder that we have different symptoms at different time points for different people, because we've got receptors for estrogen and progesterone all over our bodies. So yeah, we'll be talking more about symptoms as we go along. But that is a menstrual cycle 101, very, very briefly. But I get asked a lot around, well, what is a normal menstrual cycle? And athletes often wonder, actually the general population, is my cycle normal? And when we're talking about a normal menstrual cycle, what are we talking about? Well, you've seen the previous graph there, that graph was 28 days. Now, this is very much an average cycle, or in books, or an idealized cycle. The general population, actually very few people have a 28-day cycle, and there is quite a wide range. So normal is between 21 and 35 days. And if you're dealing with adolescents, so once they've started the period, for 2 years thereafter, or up to 3, it can be a bit more irregular, and we would expect that typically they would be between 21 and 45 days. So for a lot of adolescents reading stuff up that should be based for adults, they get a bit concerned. So I think that's always worth noting. Then when we think about how long a bleed should last, again, on average, we're talking about 5 days, but there's a big range, and that can be between 2 and 7 days. I also get asked, well, how much should I be bleeding? And it can be a difficult one to sort of measure. It used to be the guidelines would say that anything over 80 millilitres was classified as being heavy menstrual bleeding. But I think that's really difficult to sort of measure. So the NICE guidelines have recently been updated, and they've said anything that's excessive menstrual blood loss which interferes with a woman's physical, social, emotional, or quality of life, that shouldn't be that, and that should be manageable. And likewise for symptoms, they shouldn't be excessive. If you're putting in some lifestyle interventions and things, it shouldn't be excessive, and they shouldn't interfere with a woman's physical, social, emotional, and quality of life. I think all too often we tend to suck it up and get on with it, but there's things that can be done. So I think what's normal, what's not, then if we look at it a different way, then anything for a cycle length of less than 21 or over 35 days for a sort of mature cycle, if that's happening on a regular basis, then that wouldn't be normal. Anything over 8 days and unmanageable bleeding or unmanageable symptoms. I'll touch on a wee bit more of that in a wee second. And I suppose I just wanted to really highlight some of the red flags, especially within a sporting context. And one of the things would be that around absence of menses, or what we would classify as being amenorrhea. We've got 2 different types of amenorrhea. One is called primary amenorrhea, and that's if you've not started your period by the age of 15 or 16, depending on the criteria. And then secondary amenorrhea is when you've not had a period for 3 months or more, or 90 days or more. And I think this is much more prevalent within sporting sort of population. I think that there was a recent review just done actually not that long ago, looking at menstrual cycle dysfunctions in athletes, and there was almost around about 17% of athletes were reporting amenorrhea, and that had again a big range. There was about up to 60% depending on the sport. So I think one of the things around this is though it's the importance of the menstrual cycle. It is a sort of sign of good health, and if you don't have a menstrual cycle for a prolonged period of time, then it can affect things like bone health. And we end up, and I've dealt with athletes, unfortunately, that have had things like bone injuries, stress fractures and things like that. So one of the big red flags there. And then from another one would be around heavy or prolonged menstrual bleeding. That's speaking about before. Again, it is fairly prevalent that it can be up to about 40% of athletes have reported heavy menstrual bleeding, and not too dissimilar to the general population. And so what are we looking for when we're considering heavy menstrual bleeding? I think there's things that it's difficult to, people go, well, how do I know I've got that? Well, if you are bleeding through or you're needing to double up on period products, so you're needing sanitary towels plus tampons. If you're flooding through every couple of hours, these tampons or pads, and if you've got clot sizes or blood clots of 10 pence pieces or more, again, could suggest that you've got heavy menstrual bleeding. Now, again, linking it into performance, it can be an important one. I suppose it can be a factor that's related to maybe some menstrual cycle dysfunctions and underlying conditions. It may not be, but it may be. But also it can be linked to iron loss, and we know that female athletes have a greater sort of they're more susceptible to low iron stores as it is. So again, a red flag around that. And then when we were thinking about sort of symptoms side, when I was talking about there, you shouldn't have symptoms that are unmanageable. Severe dysmenorrhea, or what we classify as painful periods, they shouldn't keep you doing your normal activities if you're using regular over-the-counter medication and taking into account some normal lifestyle advice of exercising, physical activity and things. Dysmenorrhea does affect a fair proportion of athletes, around 1 in 3. Again, there's a massive range in this, and there's a massive range within the general population as well. But I don't think we should be putting up with it. And similarly, things like premenstrual dysphoric disorder, which is getting a wee bit more limelight than it used to get. It affects about up to 10 to 13% of athletes, as it does in the general population, between I think 2 and 10% in the general population. So not too dissimilar, but premenstrual dysphoric disorder is where we've got really heightened mood symptoms and heightened anxiety, depression, irritability, and actually it can be linked to suicidal thoughts. So we really need to look at these sorts of big red flags. And then, so we think about all of this and the athlete and exercisers' menstrual cycle experiences. We've been fortunate enough to do quite a lot of work in this. I'm a lecturer at a university and do a lot of research in the menstrual cycle and education. And the first study that actually looked into experiences and perceptions of elite athletes was in rugby players, believe it or not. And that's, if you're interested, you can have a wee look at these papers. We then looked at this not just in rugby players, but much more widely in different sports, again in elite athletes. And then we looked at it even more widely and looked at it with recreational athletes all the way through to elite athletes. And that third one at the bottom there also included a number of rugby players as well in there. So I suppose what do we know? I think collectively from the research that we've been doing, but also from a lot of other research that's now out there, and this only started really in 2020 and beyond. We've exponentially got much more research, which is brilliant to see. But we do now know athletes' experiences, I think, fairly well around menstrual cycle and what they experience. So we know that over 75% of athletes will report menstrual cycle related symptoms of some sort. We also know that symptom number is important, and there was a great study by Georgie Brunvils and co, and they stated that from a massive cohort, a big survey study, that over on average participants had 11 symptoms. And as those symptoms increased, as the number of symptoms increased, the likelihood of missing training and missing competition increased. So people are dealing with a lot of symptoms here. Not everyone, but there are quite a proportion of people that are dealing with symptoms. But we've also got to consider the severity of symptoms. And our last study did suggest that about 39% of athletes noted that abdominal cramps were either severe or very severe, and over 25% noted that they were tired and mood changes were severe or very severe. So I think that's one area we've got a lot of work to do within the research, is actually to work on symptoms and how we improve symptoms. I actually don't think that's good enough. We've been let down, I think, a lot in general. So let's take that outside of and hone in. How does it link to rugby players' experiences? We know that 84 to 93% of rugby players report menstrual cycle or menstruation-related symptoms, so very much fall within that normal range, or normal range, in that what we see in terms of prevalence. When we're talking about symptoms, what I'm meaning is on the screen here, you'll see a number of common symptoms. Abdominal pain is super common, back pain, breast pain, and then you've got to think about how that impacts on contacts and things. Even things like changes in bowel habits. So often we find that there's looser stools, for example, in the first couple of days of a period. Changes in sleep and changes in which can then link to changes in motivation and fatigue and things. So whole host of symptoms. I've been told that there's 150 symptoms out there. I've not quite managed to total up to 150, but I've been told that's how many there are. And then how do these symptoms, I think you can start to see how these symptoms could impact on performance. So from our literature, our research, and the research from others, again, we've got a good feel of this now. And we know that about 40 to 85% of athletes will report menstrual cycle will negatively impact on their performance in some way, whether that's in training or in competition. They note that this will be similar to the general population, is often in the days leading up to a period, and the first few days of bleeding is perceived the most negative. But I want to highlight it's not everyone, and some people stroll through this and are absolutely fine. Let's leave them be, and great that they don't have any impact. I think what we're lacking though is that positive impact, because we do have negative symptoms, but we also have positive elements where we maybe feel more energized at certain points of our cycle, maybe feel more coordinated at certain points of the cycle. But I think we're not getting that coming out in the research, because maybe people don't link it to necessarily the menstrual cycle, because there's other things that may be also impacting at that point in time. So that's kind of how we see it generally. Again, I thought it'd be worth really highlighting, this is from some of the research we've done, and players' experiences and how it impacts them, and bringing their sort of quotes to life here, or what they're saying to life. So we've got, for example, the two at the top here on the right hand side, a bit of a spectrum of symptoms in terms of severity. So you can see the first one says, I'm doubled over with pain and it gets really bad, I won't train, I take the day off. So I've had athletes say to me that they've been nauseous, they've been vomiting, but that is at the extreme end. And people needing to take the day off training. It isn't as frequent as it is for people being able to manage their symptoms. But at the opposite end of the spectrum, we've got folks saying that they've got slight cramps, they only last about an hour and they're bearable. Now that word bearable, I think we've got to question, is that good enough again? I think, again, we've got a lot to do in this area. And then on the left-hand side there, we've got one where an athlete said, I'm more tired, I struggle to motivate myself, I've got reduced sort of cognitive ability for exertion, I'm more emotional, and I'm easily frustrated. So again, you can think how that might relate to being on the field. If they're more frustrated, does that come out in training and competition? And then one really sort of common one that comes up is at all ages, from adolescents, and it is a big barrier for adolescents, all the way through, is that fear of leaking or feeling of being exposed. And often we talk about, they do mention the sort of light coloured shorts. Now that's not for everyone, we will come on to that, because I recognise that the senior team have still got their white shorts, but it's about choice here, and we'll come on to that. And then there's a sort of the impact of infrastructure, or the clubhouses not having, and this comes up frequently in rugby, is not having the best toilet facilities. And in the video you've seen there that they were talking about, or we hadn't thought about having sanitary pads in the bin with them And so yeah, we frequently see that, and it's thinking about, well, what can we do within our clubhouses and within our venues, and also showers and things like that, and avoiding actually showering because they don't want to be exposed again. So that's a whirlwind around players' experiences. We could touch on more of that, but time is not on my side. And in terms of communication, I think this isn't just in rugby. This is across the board. There is a lack of communication with coaches, and we've seen that within the poll there, that there was 25% or so, if I remember rightly, that have communicated with their athletes. But there's a large proportion, and actually that the 75 coincides with this Armour paper there. Athletes don't discuss their menstrual cycle or their symptoms with their coaches. What I would say though is I'm seeing really positive changes, and I think some of the work, for example, that we're doing here is sort of helping to reduce those barriers, and we're seeing it at elite level. So there was a Hayward, and that was in rugby, where I think it was around 45% of elite level rugby players were able to talk to their coaches. So we're moving in the right direction. My PhD students looking at this in football, and again, we're moving in the right direction at the elite level. We've still got a lot to do in that grassroots and sort of adolescent period. One of the things that often athletes say is the gender differences. So we know that it's a male-dominated environment. There's often this perception, and it is a perception, there's embarrassment from both sides. So the work that we've done, coaches often say to us, oh, I think the athletes would be embarrassed if I approached that subject. And the athletes say, oh, my coach would be embarrassed if I approached that subject. Now, often when I speak to coaches, and it'd be interesting to hear what your thoughts are as coaches and within that environment, is would you be embarrassed? Because often when I speak to coaches, they wouldn't be, but it's that perception. And then often athletes don't seek help. We know from the literature that I think there's about 15% of people will seek help if they've got any issues, and I think this goes across the board, and there's for multiple reasons. In sport, for example, some people don't want to show weakness, and especially in a sport like rugby, where you're supposed to be tough, you're supposed to be on it all the time. They don't want to show weakness. They don't want to come into selection as well, in terms of being selected for teams. So there's, in terms of athletes not seeking help, they don't maybe want to conceal they're having issues. And also, I think there's a lack of awareness and knowledge that's coming into that as well, because we know that athlete knowledge is very low, and they don't know what's not normal and what's not. And similarly, we don't know what's coaches and actually the general population don't know much about this. We've not been taught it at school, so I don't think we can be expected to know much about this. How are we doing for time? I've got a couple more slides. I'm okay for time?
Yes, as long as we're very brief on the last two slides, right. Laura.
Okay, go, let's rattle through it. What can we all do to help? I think everybody has a place in this. So I think if you're a coach, you could encourage your athletes to track their cycles. If you're an athlete, what should they track? Cycle length, how long they bleed, how heavy it is, symptoms across the cycle, not just when during the periods, and any performance indicators, and they can start seeing what's normal for them and what's not. I think education for all, I think that goes without saying. We need to be able to talk about this subject, and I think education allows us to do that. If you know what you're talking about, you're more likely able to talk about it. I think there's some things we can do. The evidence base needs to improve in here, but there's certain things. Exercise and physical activity is great for symptoms. Improving diet, sleep hygiene, and we maybe touch up on these in questions if anybody wants to. And then I think even wider than that, if you're an official or a volunteer in your club, they spoke about this in the video, but make sure period products are available. I had to bring them into my club because they weren't there when I came in. Ensure there's an away kit so they're available when they're away. Think about toilets, and think about, is there access to sanitary bins? That's not always the case. Think about going forwards and having cubicles that are, maybe have sinks in them so that we can rinse menstrual cups, for example. Think about kit. Make sure there's spare kit. Leaks will happen, so make sure there's spare kit in the away bags and at home. Kit colour. Sometimes a lot of athletes do want darker colours, but again, it's about choice, and we can see the senior team have chosen to keep their white shorts So let's consult players and what they need and what they want, and all about empowering the athletes going forwards. And I'll stop there. Sorry if I've ran over.
No, not at all, Laura. Thank you so much for that session. That was really fab, and we will come on to your questions at or any questions people have for you at the end of the session. But thank you. Just before the second Laura, apologies, Laura, delivers her presentation. Alex does have another poll to get you guys thinking. But just one thing from me. If you're in the chat function and you want to share a question or a comment, that's fab. If you can just make sure that you've changed the selection from hosts and panelists to everyone, just so that we can keep that conversation open with everyone who's dialed in. So that's it from me, and I will hand over to Alex.
Thank you, Chrissy. So that poll is with you now. Is it true you only need to look after your pelvic floor if you are pregnant or have had a baby? Yeah, if you could put your answer in there now. If any reason you can't see it, please do put your answer in the chat and join in. I can see most people have completed it. But yeah, is it true you only need to look after your pelvic floor if you are pregnant or have had a baby? I can see most have completed that now. And we have 100% on this one, sharing with you, Laura. They all believe it's false.
Right.
So I'll stop sharing that now so you can put your presentation up.
Fab. It's just coming up now, I think. It was. Does that come up now?
Yeah, we can see that. Thank you.
Okay. Oh, no, I can't.
It's gone again.
Yeah. Is that right?
It's up now. Thanks.
Fantastic. Lovely. So, yes, also thank you for having me. Hi, everyone. My name's Laura. Laura Marsland, and I am a pelvic health physiotherapist, and I own my own business called Laura May Physio, but I also used to work in the NHS. Myself, like the other Laura, rugby is part of our life. I have played rugby myself. My husband has played. I physioed for an amateur rugby team, and now we're just on the whole minis and juniors under sixes with my eldest son. So it's been part of our life for a long time, and then it's been lovely to join up my job as a pelvic health physio with the rugby side of things as well, which is brilliant. We are few and far between. Pelvic health physios do exist, and we see, well, males and females, but we see females at any point in their life in regards to their pelvic health. So again, just like your poll is, we do not just see women after having a baby or when they're pregnant. So they can have never had children, it might be before they've started their family, or they could be postmenopausal. So again, it could be any stage in their life. So what is the pelvic floor? So basically, in simple terms, the pelvic floor supports the pelvic organs, prevents leakage from the bladder or the bowel. It helps with emptying of the bladder and bowel, and it also supports sexual function. So this basket of muscles is a muscle like any other muscle in the body. The difficult thing is we cannot see it, and therefore we do not probably talk about it as much as we should. It's another taboo subject, and it's another subject in society that doesn't crop up very often, depending on, again, the setting that you're in. So hopefully by opening up this conversation, we'll be able to move forward with, we'd be more comfortable and talk about it. How do you know when something is wrong with your pelvic floor? So basically, with what the function of the pelvic floor is, how do we link that? So could it be you have pain? Is it pain in the pelvic region? And we say the pelvic region, it could be from your belly button down, it could be from your knees up, it could be around your coccyx bone, it could be in your lower back, but that could be all contributing from your pelvic floor. It could be a prolapse. It could be something that's pushing down and feeling bulging or heavy in the vaginal passage, and it might have been diagnosed by a doctor or a medical professional. And then also changes in your bladder or bowel habits, which we'll come on to a little bit later, which is loss of control of your bladder or bowel function. So it is worth noting that the list of symptoms that can occur when the pelvic floor is not working correctly, but this list shows you the range of symptoms, but it's not exhaustive. So I've tried to just collectively put them together. So you could see symptoms such as bladder leakage, which is normally called stress incontinence, bowel leakage, bladder frequency and urgency, so the need to go to the toilet more frequently, with very little urine to show, and an urgency, so a strong desire to empty your bladder because it's irritated. Bladder pain, or pain again in the pelvic area, pain with intercourse, difficulty emptying the bladder or bowels, vaginal prolapse, again can be bladder, bowel or uterine prolapse, and then lack of wind control. However, if we're then relating it back to the game, whilst the previous slide involves the overall symptoms more specifically to rugby, it could include, or you might have had the conversation in the changing rooms or in the bar afterwards, but it could be leaking when you're tackling or you're going into a tackle, jumping or running during the game, feeling the desire to go to the toilet throughout the game. So despite going just in case before the game, you then have this constant feeling or this need to go for a wee during the game, which actually, again, you don't need to because your bladder is not full. And then again, pain in the pelvic area during any activity linked with rugby. So again, the running, the jumping, the squatting, the tackling, any of those movements, does that produce any pain? And is that related to the pelvic floor? In terms of getting support, again, it's a bit of a taboo subject, so we're not too sure where to reach for. A lot of ladies don't know where to go to. But again, speaking to a member of your club if you are concerned about any of your symptoms, and then you may wish to speak to a GP to get a referral to your local pelvic health team within a hospital setting, or you may wish to seek out private pelvic health physios that you can obviously search for locally by putting your postcode in on one of the websites on the toolkit, which is a POGP website. And then you also might need to have that discussion about adapting your training whilst you're doing rehab for your pelvic floor. So yes, I can join in with these drills, but no, I can't join in with the tackling or again the running drills or anything, but you can use you can do the strength training or something. Rehab and exercises. So alongside specific pelvic floor exercises within the toolkit, we want to think about the strength around the pelvis in general. So again, that basket of muscles within the pelvic floor needs support from the bigger muscles around the pelvic floor. So if I just show you my example of the pelvic floor, here is our basket, but they are quite fine muscles, and again smaller than the glute muscles, smaller than your hamstring, smaller than your quads, etc. So these muscles need the support. So yes, you can do the specific squeezes, which we'll talk about in a minute, but also thinking about different ranges of what we can do with the pelvis. So the big one, do we have good mobility? So are we doing dynamic stretching? Are we incorporating any yoga or yoga moves as such, to sort of summarize? But are we using the hips to a good range? Do we have good strength on both sides? So does the left equal the right? Just to name a few, the list again can go on, but can we go up and down on our tiptoes on the left? Can we go up and down on our tiptoes on the right equally? Can we do a good old bridge, but can we lift with our left leg and can we lift with our right leg? Can we hop on one leg? So again, that pushing off mechanism, but also leaving the floor. Can we lunge from side to side equally? Again, does our left hip support our right hip? And like I said, there's plenty more that will be available on the injury prevention website. And then do we have good dynamic strength without symptoms? So can we jump? Can we jump and squat? Can we do frog jumps? So can we jump forwards and backwards? and then can we jump onto a box or a step or a weight plate? Can we do those and we aren't leaking, or are we not getting any pain? So these are the bigger picture in regards to just saying, just squeeze your pelvic floor, as most GPs, or maybe most Googling of how do you strengthen your pelvic floor may come across. So these are a bit more specific. Oh, that's on to my questions, but going back to the rehab exercises, just to remind you, when we're talking about the pelvic floor, it is quite hard to visualize what's going on the pelvic floor. So some people need different instructions. So it might be we squeeze our pelvic floor like we're trying to stop gas from escaping. It might be that you close your back passage and that's how you squeeze your pelvic floor. What does it feel like to stop the flow of urine? That might be an image that makes you squeeze your pelvic floor. Or imagine that you're closing a zip from your back passage up to your front passage, and again, does that make you squeeze your pelvic floor? It is quite a fine movement. It's not a big movement, so therefore you shouldn't see anybody doing it. It's a secret exercise, and again, you can tap into it once a day. You can tap into it a couple of times a day, but it's your activation and your knowledge of that area and that muscle that will allow you to improve your symptoms, and having that support system around you will also help you move forward with that as well. And that's me done.
Fantastic. Thank you so much, Laura. So we're now going to open the floor to questions. Hopefully no one will mind if I start with the first question, which is to both of you guys. What would you say if you had only 3 top tips to give to a rugby athlete to enable them to look after themselves, be proactive? What would they be? And I think Laura Marsden, you've just spoken, so I'll give you a second to get a sip of water. If I start with Laura Forrest, if that's okay.
Yeah, so if I get this right, what would I suggest athletes do? Top tips? Yeah. I would say get to know their cycle. I think that tracking of cycles is really important for a number of reasons. I think it lets people establish what's normal for them. I think it allows that sort of, for a lot of people, then the predictability. So they actually know, oh, I'm not taken by surprise that my period started on the day it has done. Yes, there's going to be variability from month to month, but knowing what's normal for you from that perspective. I think also that it allows you to start seeing patterns in how you might be feeling, and then being able to use strategies to sort of help with those. So for example, if you're really struggling, I for example struggle to sleep in that late luteal phase, so that coming up to my period, and that is often quite common because we've got increases in body temperature and things like that. And so I really have to focus on things like sleep hygiene and make sure that I'm off the screens, I'm off of the laptop by actually usually about 8 o'clock, or it really does affect me in terms of blue light emission. And so that sort of thing you can start putting in your own strategies and going, okay, and actually being a bit kind to yourself, going, right, I feel that's why I feel a bit crap. It'll pass in a day or two, or being able to prepare for games and things like that as well. So I think for me, tracking is a big one, and if you can, I would say if it is affecting you, then do broach it with coach, with folk, or even start within the team. And if you feel as though your coach wouldn't be receptive, then it's maybe having, like, for some places for younger folk, it's maybe having one maybe older team player or that's comfortable and saying, listen, there's a number of girls that are really struggling here, or would like to have a more open conversation, and maybe just do the dialogue between 1 or 2 people initially. And and education, I think so that'd be my third one, would be education. We can't speak about things if we don't know anything about them. So I think and that helps us to overcome taboos and things. So yeah, I think, is that covered 3 that you're after?
I think you absolutely have done. So yes, thank you very much for that. I appreciate sometimes 3 sounds like at one point kind of quite a lot, but also really restrictive when there's so much information and so much we can do to empower ourselves. So thank you, Laura. Right, Laura Marsland.
Yeah, so maybe a bit of an overlap from my point of view, but one of the biggies I would say was normalise the conversation about the pelvic floor. So again, you know, just having that information like, oh, did you know that you could do these exercises to help your pelvic floor? Or if there might be someone that laughs and jokes, say, oh, I've just wet my pants doing that tackle or doing that jump, then again say, did you know that you've got you know, the toolkit available, etc., to utilise. So again, making it a conversation that's more normal than it has been in the past. Second one, maybe more to get to know your body. So again, have a bit of a move around or a little bit of a, okay, what does it feel like in lying to squeeze your pelvic floor? What does it feel like in standing? Do you know how it moves? And do you know that the brain is working with the pelvic floor? And third is, again, just making sure that you do act. So if you're starting to notice any symptoms, maybe to do with, again, the aging process of our bodies, access help early so you do not allow those symptoms to worsen.
Fantastic. Thank you. And just before you go on mute, Laura, I've got a question for you from Amy McHenry. Is there a point of no return for a pelvic floor?
Open-ended question, but to be honest with you, it might be a point when there is access to either the GP or a consultant gynecologist where they would be saying, okay, we now need to consider something like surgical intervention if it's more to do with maybe a prolapse. So again, the grading of where a prolapse sits in the vaginal passage or out of the vaginal passage, whereas you would need, again, more medical support from that point of view. From a leaking point of view, you would really want to be taking maybe more of a cautious return and say, okay, well, I do need to stop the activity that is related to my symptoms. So again, is it rugby? I need to come away, I need to do my rehab and then be able to incorporate it back into play. But research suggests that 80% of women with pelvic floor symptoms get better with physio.
Fantastic. And I suppose in that way, it is a collection of muscle and ligaments, the same as if we had an injury with our knee. It's allowing the body to recover and to go through that work. And hopefully you'll agree. I think prevention is always better than needing to recover. So in the same way that we have the Activate program as an injury prevention program, kind of musculoskeletally doing the sort of exercises Laura's spoken about today and that are contained within the pelvic health toolkit are going to hopefully prevent us from getting to those situations where we need to take prolonged periods of time out of the game. But yeah, thank you, Laura. I appreciate that. Was a very open question. One question that has come in from Alex: is there anywhere we could direct teenage girls for good techniques to help manage menstrual cycles? It's almost, Alex, like you were a plant for us. You're not a plant, but I appreciate it. And I can see that Rachel has already shared the link in the chat to the women's and girls toolkits, which are our RFU resources. So we have the menstrual cycle toolkit, which was developed with Laura Forrest. We're very grateful to her, which covers the menstrual cycle for anyone who menstruates, irrespective of age. But we also do now have the puberty toolkit, which obviously discusses all aspects of female puberty, but there is a good amount of reference in there to those kind of early years of menstruation. So I would definitely signpost you to both of those as good starting points. Right, looking at other questions we have. Is there, from Maureen here, is there a link between hormone peaks and troughs in a menstrual cycle and ligament injuries in female athletes? So I will jump over to Laura Forrest in a second, but again, this is an opportunity for me to have a plug for the CRISP program. These are the kinds of questions that Rachel and I would really like to have data so we can properly understand. So again, another plug for CRISP, which you can also find within those toolkits. But I will jump over to Laura for what we know currently.
Yeah, and I think, Chrissy, the reason that you're wanting the data is that we don't have enough data in this area. I think the literature, unfortunately, is in this sort of, because there's in the media you'll see a lot around ACL injuries, and women absolutely are, and Laura can probably come in from her perspective, and that there is an increase prevalence of ACL injuries in females. Now, is that as a consequence of the menstrual cycle? I think it's inconclusive at the moment in terms of that. I think that the menstrual cycle, in terms of does it predispose, we don't know that at the moment in terms of the evidence base. There is contradictory evidence within the literature. I think that the problem is there's other external factors that come into play for things like this. So you've got things like even women playing on different surfaces, and probably poorer surfaces than their male counterparts often. They're often on different pitches to males, although that is improving. We've got technique issues. You get sort of the training years behind it. So there's talk around, well, do women in games such as football and rugby, have they had training history that often their male counterparts will have? And yeah, so there's even things like folk talk about different the boots that women wear. They're not made for women oftentimes, so are they specifically for women? So there are lots and lots of factors that come into play, and biomechanically as well, in terms of that sort of ACL injury. I don't know if Laura wants to come in from her perspective from physio. Put you on the spot there, Laura.
Sorry, sorry, my iPad's dying of a slow death. No, that's fine. Yeah, so again, it's that inclusive. It's inconclusive because we just don't have the data to match injury prevalence and menstrual cycles, and that's the problem. But we do know, again, as we age as well, we do have this increase in soft tissue injuries or ligament injuries or niggles, and again, the way we train, are we actually reflecting the menstrual cycle with our training packages, or have we not moved on to that as yet?
Yeah. And I think, just to add to that, sorry, I think anecdotally sometimes I see, and this is anecdotal, it's not in the literature at the moment, is that towards the menstrual cycle, towards menstruation, when we often see increases in inflammation or inflammatory markers, and oftentimes athletes, I don't know if you see this, Laura, they'll come and say that something, maybe an old injury, starts to flare up ever so slightly, or those wee niggly things start to come back a wee bit, and they maybe have to be a wee bit more careful and do a lot more prehab, a lot more sort of warm-up activation stuff to work. But that is very much anecdotal, and it's not out there at the moment in terms of literature.
Yeah, and similar for me, it's when, say, for example, you've had an old ACL injury that yes, you rehabbed at the time, it wasn't operated on, but then has that led to then an issue further up the chain in regards to the pelvic floor, and say, for example, then someone's gone on to have a baby, and again, has that brought things up.
Fantastic. Thank you, guys. And just a very brief one for you, Laura Marsland from Caroline. Having just had a baby and struggled with pelvic girdle pain and returned to rugby, I'm so glad I joined this call. So there's a little accolade for you there. I'm mindful we're very near the end, but I did just want to touch on a question that's come in from Ali Mortimer around potentially, as a coach at senior level, players might not want to highlight that they are struggling in case they don't start in a competitive squad, lose their spot, and how has this been addressed before? I think it's a really good point you've raised, Ali, and I think it highlights the need for us to have more conversation around women's health and the menstrual cycle and pelvic health in particular, and what that means for a player, and normalise as much as we can that this this is normal, and it's kind of a healthy part of being a female rugby athlete. As I said at the beginning, in the toolkits, we do have specific sections for coaches and those who support female athletes in how they can support those players to engage in training or rugby activity, even on those weeks of the month where they might not be feeling as good as they can. A little bit of movement and being active and being on the pitch with your friends is far better than feeling that you're not able to be there. But what I will do is, I think these kind of conversations are really, really useful for us to have and to think about as we develop those toolkits further. So thank you very much for popping that question in. Rachel's just popped in a sign up for CRISP at the very end there. Thank you, Rachel, and for Activate as well. Fabulous. For those of you who've asked about the recording, it will be made available to you, and it will be within the toolkits. So again, a little plug for you to go and save that link, have a look in there, and that's where you will find you'll be able to find a copy of the recording in the next few days. There we are, only 1 minute past 8. That's not bad. Thank you guys so much for attending this evening, for your questions and for your engagement in the subject. It's been a real privilege to have you guys here, and thank you very much to the two Lauras. Working with you and hearing from you working kind of day in, day out within these subjects. I always enjoy listening to you talk about it, and I always come away with another new good little nugget. So thank you very much, and good evening, everyone.